Afternoon, everybody. My name's Dave. I'm from a company called Damibu. We do digital health technology, and our innovation is Catch, and I'm an IA fellow. We're all about the kids and the parents. Generally, this year, on average, about 5 million A&E attendances will be for kids for under 5. However, 750,000 of those will be for non-clinical reason, i.e. they'll turn up at A&E, and all they'll be given is advice, either written or verbal, or even in some cases just said, go home, it's nothing to do with it. Some examples of that are people turning up with nappy rashes. One I heard today was a kid turning up with carpet burns, and the mother thought it was meningitis. And this costs the NHS 50 million a year. So generally what we developed was a mobile app which encourages child self-care and the parents. However, we're also very concerned about the parents and the stress they undertake going to A&E and having to wait for 3 hours sometime for no reason whatsoever. It was developed over the last 2 years in Cheshire East. We worked with the 2 CCGs in there and also the public health. And we've had some very interesting feedback and results. So from an in-app user survey, we found that users are saying they're 87% more confident in self-care, which is great. But also, more importantly, the users are saying that they are choosing self-care instead of going to A&E. That's 57%. And over that period, between the winter before the app and the winter while the app went on, just within 6 months, they had a reduction of 28% in these guidance-only intakes or attendances for kids under 5. So that's quite a big reduction in that. What we've also found out just last week was that we're in 3 CCGs at the moment, but Cheshire and Merseyside are taking it up full-heartedly. So by the end of February, we'll then be in about 14 CCGs regionally. So that's what we're doing. So what is it actually? So we're all about delivering self-care innovation, self-care information, but at the right time. What we found out over those 2 years, fairly obviously, it's no point in when the child's crying in the mother's arms saying, pick up an app and read it. So what we have is a lot of information in there, about 400 articles at the present, and about 150 of those are timed and notified to the parent based off the child's age. So the parent enters the child's age, and from that we can tell what of these bits of information are delivered to the parents to try and preempt them going to A&E or preempt them going to the GP. So we call this informed before need. However, not only is that information taken from NHS Choices and these really nice places and NHS Scotland, we also then augment that with support information as well from national places. So we've working with ERIC, which is the National Society for Bowel and Enuresis. We're talking at the moment to the Royal Society for Blind Children. We've got quite a few other places we're talking to about getting information in and also allowing national support. However, the slight difference is that we talk about these CCGs and the regions because they all share in the technology, but they control their own region's information. So when we do add ERIC or we do add Child Smile for Halton because they wanted more dentistry, it doesn't get added automatically to everybody else. We then go out to Liverpool, go out to Halton, go out to St Helens or wherever and say, do you want this as well? And it's up to them whether they do. So although everybody shares the technology, they have complete control over what their individual patients or systems see. This means that they can target it precisely to their region's campaigns that they're running. On a weekly basis, on a monthly basis, we don't mind. And we don't mind because it's delivered as a service to these regions. Normally as a partnership between a CCG or public health or a trust would get involved or anybody. But generally, it's sold as a service to a region. As content management, we do that. As marketing, digital marketing, pull-up banners, flyers, we'll do all the design for that, we'll deliver them. Social media, we'll do. Training, we'll go out to midwives and talk to them about it and tell how best to use it, help them download and know what it is they're going into. And also we deliver reports. We deliver reports via email, but at any time you can also go online and see exactly who's using the app, and even see who's using it on a postal district basis. So you can even tell if somebody in your area to the left is reading about bronchitis and on the right they aren't, or something like that. We're IG compliant. We've intentionally done all the personalisation so that the personalisation happens on the app, so no information of any sort of personal nature is held in the cloud. It's very, very easy to take up. It's very cost effective. I know the rough idea is that in, say, Sheffield CCG, is fairly big CCG, just through A&E, if they match what we've seen in Cheshire East, they'd see 100k saving in their A&E tariffs, and that would only cost them around 18k a year for the service. And the +9 is the sort of like first year setup fee. For Harrogate, smaller figures. So we reckon for West Yorkshire, and this is the proposal we put to Cheshire and Merseyside, that West Yorkshire would save about £500,000 a year for about 100k annual fee to cover all the CCGs in there. And the timescales are very quick as well. 4 weeks to launch with just NHS choices information, and then we spend another 4 weeks customizing it and working with the CCGs to get exactly the right content they want in. And then after about 12 weeks during those periods, continuously, we'd be training your staff and working with you how to get out. Thank you.